Hello everyone. Today we will be learning about the segmental breathing. It is a physiotherapy technique which is used to improve the regional lung expansion by directing the inspired air to the specific lung segment using a manual cues and deep breathing technique. Indications are atelectasis, that is localized lung collapse, post-op thoracic surgery, post-abdominal surgeries, pneumonia, chronic obstructive pulmonary diseases, bronchiectasis and restrictive lung disease. Reduced chest expansion, neuromuscular disorders causing weak respiratory muscle, and prolonged bed rest. Contraindications: absolute, untreated pneumothorax, severe respiratory distress, massive hemoptysis, flail chest, unstable chest trauma. Relative contraindications are acute rib fractures, severe osteoporosis, severe chest pain, recent thoracic trauma, acute pulmonary embolism, hemodynamic instability, patient unable to follow instructions. So, types of segmental breathing, there are three types. First is apical segmental breathing. Purpose is to improve expansion of upper lobes, and patient position will be sitting upright or a semi-fowler's position with the back supported. Therapist hand placement: place both the hands just below the clavicles on the upper chest. Procedure: explain the technique to the patient, ask patient to exhale normally, apply gentle pressure downward during expiration. At the beginning of inspiration, release the pressure and give a quick stretch. Instruct the patient to breathe into my hands. Ask the patient to hold breaths for 2 to 3 seconds. Exhale slowly through the pursed lip and repeat it for 5 to 10 times. As you can see in the diagram, the therapist is standing behind the patient, both the hands below the clavicles, and ask the patient to inspire and then exhale. While exhalation, give downward and pressure and stretch. Second is lateral costal segmental breathing. Purpose is to improve expansion of lower lateral ribs and lower lobes. Patient position: sitting or sideline. Therapist hand placement: place both the hands over the ribs 7 to 10 on the lateral chest wall. Procedure: patient breathes out completely. Apply gentle inward pressure during expiration. Release pressure as the patient inhale deeply. Encourage the patient to expand the ribs sideways against your hand. Hold inspiration for 2 to 3 seconds. Exhale slowly. Repeat it for 5 to 10 breaths. Here is the diagram. The therapist is standing beside the patient, both the hands laterally to the chest wall. Ask patient to inhale, then exhale slowly and give downward and inward pressure with your both the hands. Third one is posterior basal segment breathing. Purpose is to improve ventilation of the posterior basal lung segment. Patient position: sitting and leaning forward, sideline or prone. Therapist hand placement: hand placed over the lower posterior ribs. Procedure will be: ask patient to lean forward, place hands on the posterior lower ribs, apply a gentle pressure during expiration, release pressure at inspiration. Instruct the patient to expand the back of your chest. Hold the breath for 2 to 3 seconds. Exhale slowly. Repeat it for 5 to 10 times. As you can see in the diagram, the therapist is standing behind the patient and both the hands posterior to the ribs, and ask the patient to inhale and exhale slowly and give inward and downward pressure. If you like the video, then subscribe to the channel, and if you want more videos like this, then let me know in the comment section.